For 30 years, the Supply Chain Management Association of the Philippines has been at the forefront of the Philippine supply chain, advocating for policies, initiatives, and practices benefiting the sector. With the help of stakeholders in the public and private sectors, communicating the movements, trends, and developments affecting the profession through regular events online and offline, and educating supply chain professionals from the boardroom to the warehouse floor. For 30 years, the Supply Chain Management Association of the Philippines has recognized that a strong supply chain plays a role in building a competitive and strong economy and ensuring higher standards of life for everyone. This is why, for the past 30 years, the Supply Chain Management Association of the Philippines has worked tirelessly across the country and around the world towards a world-class Philippine supply chain powered by a capable supply chain sector, supported by a responsive regulation, and led by a culture of collaboration. And we will continue to connect, engage, and move now and into the future. We are the Supply Chain Management Association of the Philippines.
Makibahagi sa pagpapanatili ng maayos na supply chain at logistics ngayong panahon ng community quarantine dulot ng COVID-19. Pumunta sa iatfscan.net o sa Google Play Store, i-download ang SCAN Incident Reporting app sa inyong cellphone at magrehistro. Ang SCAN Incident Reporting app ay isang mobile app na maaaring gamitin ng sinumang nasa transport services, public servants mula sa iba't ibang ahensya ng gobyerno, mga manggagawa na naglalakbay papunta at pauwi mula sa trabaho, mga kumpanya na gumagawa o nagbebenta ng essential goods and services tulad ng pagkain at gamot, o mga miyembro ng industry associations tulad ng SCMAP, PhilExport, PCCI at Export Development Council. Ginagamit ang SCAN Incident Reporting app sa pag-report ng mga issue o sitwasyon na nakakaabala sa daloy ng supply chain at logistics sa ang bahagi ng bansa. Halimbawa ng mga issue ay pagkuha ng quarantine pass, pagkalito sa bagong regulasyon o ordinansya, pagtawid sa quarantine control points, sinarang mga kalsada, mahabang pila ng mga sasakyan, aksidente sa daan, o anomalya sa presyo ng mga pangunahing bilihin. Ang SCAN Incident Reporting app ay sumusunod sa Data Privacy Act at sinisiguro na ang bawat report ay pinapanatiling safe and secure sa isang database na ma-access lamang ng kinauukulang tao at sangay ng gobyerno. Ang inyong mga incident reports ay agarang maipapakita sa SCAN dashboard na gagabay naman sa NTF COVID Operations Center sa pagmonitor, pagtugon o pakikipag-ugnayan sa mga LGUs ukol sa mga isinumiteng issue o sitwasyon. Kaya tayo na at magkaisa upang mapanatiling maayos ang daloy na supply chain at logistics sa ating bansa gamit ang SCAN Incident Reporting app.
Habang nakatigil ang mundo, habang ligtas tayo sa ating mga tahanan, may mga pumiling manatili sa harap ng digmaan. Laban sa COVID-19. Para sa inyong patuloy na nagpapatakbo sa makina ng bansa. Para sa inyong laging nakaabang sa ating mga daungan at paliparan. Para sa inyong nagtatawid ng aming mga pangangailangan sa kalsada, karagatan, at himpapawid. Para sa inyong mga nagbabantay sa mga warehouse at terminal. Para sa inyong mga nakikipagsapalaran sa daan. Para sa inyong naghahatid sa amin ng malasakit at kabayanihan. Kayong mga frontliners sa logistics at supply chain. Kakibat kayo ng mga doktor, nurse, sundalo at pulis. Patid namin ang mga sakripisyo ninyo at pagtitiis. Kasama ang buong sambayanan, kaming lahat ay nagbibigay pugay at taos-pusong nagpapasalamat sa pagharap ninyo sa tiyak na pahamak para sa bayan. Mabuhay kayo, mga bayani ng bayan.
Good afternoon to everyone watching us live through Zoom and Facebook. I am Ana Rosa Choa, the Program Director of SCMAP. Welcome you to this afternoon's event. Welcome to the first ever SCMAP Live, Your Health and Safety in the Workplace. This is our initial offering of free online events where we explore what the new normal means for the supply chain industry. It is good to have you back for this first event in 3 months. We may have had to put a pause on our regular general membership meetings because of COVID-19, but we have not stopped working to make sure that all of us across the supply chain are able to continue serving our customers in the best way we can at a time when they need us most. I hope that you are safe in the comforts of your office or home. We would like to make this webinar as interactive as possible. So we'd like to ask you to prepare to engage in these activities spread throughout the session. There will be a poll time, and tell us what you think about the presentations, and we will be opening the floor to question and answers later on. So without further ado, let us now begin with our program proper. So to tell us more about what activities we have been up to in the recent months, let us all give a virtual applause to the President of the Supply Chain Management Association of the Philippines, Ms. Christine Pardiñas.
Ito si Christine, John. Ito yung ma-order sa akin. John, ito siya.
Good afternoon, everyone. I will just share my screen. Wait a minute. Something is happening. Okay, looks like some things are not, wait. Nico, can you help me, please? Nico? Okay. Can you now see my screen?
Yes, Christine, we can see your screen.
Yes, we do.
All right.
Yes, we
all
do.
right. Okay. All right. Okay. Good afternoon, everyone. So a little bit of difficulty is it's our first time to go live. Welcome and thank you for joining us this afternoon. We have a lot of things, exciting things to share with you today. So be with us in the next hour to discuss things that are really very relevant in our business and industry. A lot of you probably was with us during our supply chain outlook start of the year, and I just reviewed my slides during that supply chain outlook we had at start of the year, and it seems like my first bullet that time, 2020 will begin the decade with where resiliency defines winners. So with everything that happened to us for the past 3 months, it's all about resiliency. It's about recovery from the things that we have been experiencing. But even then, SCMAP did not stop. Timers in this event of SCMAP, give me a few minutes, please, to introduce our association. We are the Supply Chain Management Association of the Philippines. Our existence is mainly anchored on 3 pillars: advocacy, communication, and education. Advocacy is on focusing policy reforms on how to improve the supply chain competitiveness of the industry in the country. Communication to continue sharing ideas and latest developments in the supply chain community, and of course, education is to pursue the relevance of supply chain in nation building through further education. Who are helping us to do this? We have 5 major committees working hand in hand in order to bring us across these 3 pillars. And how to do it? We have been embracing the connect, engage, move advocacy for the past 2 to 3 years from our past president. It's about connecting to issues, engaging with the stakeholders, and moving towards resolution. We have planned to have all of these activities throughout the year, but then again in February, after the supply chain outlook, where we discussed digital economy, and I'm sure this came very handy to us, for us in the past 3 months, as we all learned how to order online on our essential products. So after that month, where we had ASEC Jean Pacheco, who has been with us through thick and thin for the past, especially for the past 2 months under quarantine, everything stopped. So we all know that we were kept at our house, but then again, we in SCMAP worked together with the government and other stakeholders to prepare for the new normal in supply chain. We all know that in supply chain, logistics, we have been encountering a lot of issues even before COVID. It's about capacity issues, traffic issues, fuel, everything, and capability as well of our people and how to prepare them for being competitive, globally competitive at that. So what have we done so far? As far as our ACE advocacies and communication programs are concerned, we have been working with our counterpart associations from LSPH, working hand in hand with the Export Development Council, NCTL, primarily, very recently, primarily on issues on logistics. So just very recently, we received a memorandum circular. It's 19-2018. It's about the craneage charges that we have to pay for the usage of the key cranes in Terminal 1. So we have worked with NCTL, where ARTA sent a letter to PPA to question the implementation of the charges. And of course, on the communication leg, we have worked very closely with the different task groups, sub-task groups of IATF. We have been communicating with our members when at the onset of the quarantine. Not everybody understood the importance of truck deliveries. So all the experiences that we have, all the checkpoints, everything in order to keep the goods moving. We have been at the meetings, several meetings, to make everyone understand the importance of what we do. And of course, education, we haven't stopped working with our partners in order to continue the capability building of our supply chain practitioners. And of course, connecting, engaging with everyone in order to keep supply chain moving. As far as moving on resolution is concerned, we have been working with UP and coming up with a task respond from the UP PAF respond on the IATF sub-task force led by NEDA in order to come up with a scan dashboard and incident report app. So I hope a lot of you have downloaded the app and used it to report any bottlenecks regarding logistics when you are stopped at the checkpoint. This will help us gather information on how to provide solutions and monitor the progress of keeping the goods moving. So these are just some of the activities that we have been working on. At the end of the year, we plan to have our biggest event as far as SCMAP is concerned. We initially scheduled it in September, but of course, we are still one in the vision of being competitive, sustainable, resilient, which is very apt and very applicable in the situation that we are in now. We are happy to share, crossing our fingers, that we will be pushing through with this one in November. So stay tuned on our emails and communication about our supply chain conference by end of the year. As far as our business strategies are concerned, I'm sure a lot of you, when going back to the office, have reviewed all the vision and strategy, of course, on target, on the revenues, targets, budget, expense, everything about financials, understanding our customers better, the new essential items that our customers want, essential services, and of course, hand in hand, keeping up with the e-commerce, wherein we need to adapt with the new trend now of automation, e-commerce, and of course, reviewing our internal processes. So for today, we will be focusing on safety and security, which is why we are bringing you today our for our session, our main topic of health and safety in the workplace, which is really, really very relevant. I'm sure a lot of you have tuned in because you are excited to hear Dr. Dance from QP College of Medicine our very own Dennis Llovido from Nestlé, and of course, our friend from Fast Logistics, Mr. Marvis Marfil, to tell us more about health and safety. So with that, thank you very much. Let's keep supply chain moving throughout this pandemic and beyond. Have a good afternoon and happy listening. Thank you.
Thank you, Christine, for that informative presentation to showcase SCMAP being front and center in reaching out and collaborating with government agencies and institutions to ensure the unhampered flow of goods amidst this pandemic. I know that there are some tuned in now who are not SCMAP members, so we encourage you to apply for membership with SCMAP. You can just contact our secretariat for details about that. Now, before we proceed, we would like to remind our participants that via Zoom that you can raise your question throughout the afternoon by using the Q&A function on your Zoom app. We will have an open forum after all the speakers are presented. If you want to ask your questions through audio or video, please do so, and we will get in touch with you as soon as we can, but after all the presentations. So this afternoon on SCMAP Live, we will look at how we can ensure yourself, health, and safety in the workplace. While some of you may still be in the remote flexible working arrangements, some may have reported back to the office, at least for some days. As we work to serve our customers in this time of upheaval and uncertainty, how can we keep ourselves and our colleagues safe? So later today, we will hear from our members in the manufacturing and logistics sectors to share their best practices. But first, we will be joined by a renowned doctor and professor, Dr. Antonio Dans. He is a professor at the University of Philippines College of Medicine, an academician at the National Academy of Science and Technology, the director of the Asia Pacific Center for Evidence-Based Medicine, and associate editor of the Journal of Clinical Epidemiology based in New York. He is the lead author of the book Painless Evidence-Based Medicine, and has authored over 90 papers and 30 books. So ladies and gentlemen, let us all welcome Dr. Antonio Dans. Thank you, Doc.
Thank you, Ochi. I'll share my slides now. Before I start, maybe can I give participants a minute to answer a quick question that I've shown on the PowerPoint. You can log on to menti.com and put in the code 912695 to share your answers. I'll just give you a minute. And while you're responding, maybe I can thank the Supply Chain Management Association of the Philippines. Two things. First, thank you for inviting me to talk to you today about workplace safety. And also, I'd like to thank you for helping assure an uninterrupted supply of food and medication and other essential products during the pandemic. I think many people don't know that this important work that you're doing, including me. And so you're some of the unsung heroes of this pandemic that have made sure our country survives. Okay, so well, I'll keep this up to date now and then. So this is a word map showing your responses. So it's a mix of happy feelings, rejuvenation and excitement, with some people worried and anxious. So there's some fear, there's some happiness, there's people are tired even as there's start. The biggest words are the most common, so anxious and anxiety. So just please keep the word map going. This is the combined cerebral cortex of the people in this Zoom meeting, showing our emotions. So I sort of expected that, so I tried to grab a picture of what we might all look like inside. So we all look something like this, no? A mixture of emotions. And my slide, can you see my slides now, guys? I'm not sure it's showing.
Yes, Doc. We
It
can see
is.
your slide.
Okay.
Yep.
Okay. So I want to address the part that's anxious. And by the outline of my talk to address that anxiety is to talk about two things: mass testing for return to work and other strategies for COVID-19 safety. I divided mass testing into three parts. What are the types of tests for COVID-19? How do we measure and understand the accuracy of tests? And third is, what's the most accurate test to use for mass testing? I will deal lightly on other strategies because our next two speakers will talk about that as well. And so I'll focus mainly on mass testing. So let's start. So there are two main types of tests available now. It's the polymerase chain reaction, which detects the virus through swabs of our nose and throat, and blood tests for the antibodies, rapid antibody tests, which entail prick in our hands or in our fingers. So this is how we obtain the RT-PCR at the testing centers, so swab centers. And this is what the rapid antibody test looks like. So you drop some blood here at the test kit, and the color change tells you, no, parang if you have antibodies or not. To understand how these two types of tests relate, I drew this theoretical graph of the relationship between the virus and antibody levels. So the timeline is on the x-axis, and exposure is at 0.0. So the first thing that happens is the virus multiplies in different parts of the body, depending on what the virus is. It could be at the blood or in the respiratory tract. So these are the organisms multiplying. Soon after, our body launches an attack by producing antibodies to kill those viruses. And the first line of attack is an antibody called IgM. It rises early, but it's transient most of the time. The next line of defense in the body is called IgG. So it rises later, but it has a longer duration of action. Main purpose is to prevent future infection. I remember them through a mnemonic in medical school. No? IgM kasi IgM muna. IgG kasi IgG gasunod pagkatapos ng IgM. So this divides the graph into 4 parts. But before that, these are the molecular tests detecting the virus, and these are the antibody tests. So these are the two general types of tests. Now, 4 parts. In the first part, persons with no infection yet. In this phase, IgM is negative and IgG, they're both negative. In the second part, you're now infected and contagious. Your IgM is positive, it's gone up already, but your IgG is not yet there. In the third part, you're recovering. Now you have both IgM and IgG, and so the numbers of virus in your body are declining now. So you're recovering. Both IgM and IgG are positive. And in the latter part, during recovery, your IgM is now gone, but your IgG is persisting to protect you. So that's the recovered phase. And now you have IgM negative and your IgG is positive. So that's the relationship between the antibody and the virus levels. And those are the two general types of tests. Now, how do we measure accuracy of tests so that we can understand the most important part, which is the last part? What's the best test to use? How do we measure accuracy of tests? There are two common measures. There are many measures, but these are the two most common. Sensitivity, which is the proportion of patients with disease who have a positive test. So if you have disease, what's the chance that if I test you, it will turn out positive? It's also called the pickup rate or the true positive rate. Then specificity is the proportion of patients without disease. So you're healthy, or maybe you're sick, but you're sick of something else. So the proportion of patients without disease or without COVID who have a negative test, that's the specificity. So both are the proportion of correct. Sensitivity is the proportion of correct test results in patients with disease. Specificity is the proportion of patients with correct results among those who don't have disease. Now, when we do a study to validate these tests, we do two tests on, like 1,000 or 100 patients. We compare the test that we're testing to a gold standard, which determines if patient has disease or not. No? So disease status is determined through the gold standard or a reference test. And we compare it to the test results. And we do it on 100 patients and put them on these 4 different cells. So for example, if you had 1,000 patients, 200 of them had disease and 800 of them did not. And if you did use the test with a sensitivity of 90% and a specificity of 80%, this is how things would turn out. Of the 200 with disease, the test would detect 90%. So they would fall here. 180 would be detected and 20 would be missed. The test would be negative even if that patient is sick. We call this cell the true positive patients, right? They have a positive test and they have disease. So this would be called what? The false negative. They're negative, but you actually have disease. So similarly, on the other side, among patients without disease, specificity will detect 80% of the 800 and label them correctly as having no disease. So 80% of 800 is 640. It will mislabel 160 patients as having disease. So this cell, we call them true negatives. Test is negative and they don't have disease. And these are the false positives. The test is positive, but they're actually healthy. Now, when we distribute it like this, we can now determine how many will have a positive and how many will have a negative test. When we use this test in the field, we'll have 340 positive tests. Nearly half will be wrong. We will have 660 negative tests. Most will be correct, but we will miss 20 patients who have disease. So sensitivity and specificity. We'll go back again to that. If we do that to antibody tests and compare them to actual viral load, is the virus present in our body or not as gold standard, you can see in this graph that the performance of antibodies is time dependent. Early on, IgM will work. Later on, IgG will work. Somewhere in between, they'll have a share of performance. So the point is, how they perform is time dependent, right? That's how antibodies are by their very nature. So when people say this test is 99% sensitive and 99% specific, always follow up. When was it done? Was it done early, in the middle of the disease, or late? So now let's look at the most accurate test to use. And the reference I used here is finddx.com. It's run it's a WHO collaborating center where they update almost daily all the studies on sensitivity and specificity so that we can keep track of what the good tests are. And here are the rapid tests. Specificity on the x-axis and sensitivity on the y-axis. Each dot is a study. The big dots are big studies and the small dots are small studies. And you can see here there are about 50 studies on their sensitivity and specificity. And the specificity is generally good. It's on the right. Most of the dots are on the right side of the box. A specificity of 90% or plus. But that's overall sensitivity and specificity. And as I said, it has to be time dependent. So if I remove the overall and look at studies that measured its performance according to time, so I'll unclick, you'll see that now instead of 50, I only have 3 studies. And if I limit only to the first 14 days, because the disease is only contagious on the first 14 days, then I only have 2 studies, okay? And their sensi-speci is not really that high. This is the better study, and if I click that dot, it will show you. I'm not sure if you can read this. This is from China in the Zhonghan Hospital. It's the Zhuhai Livson Diagnostic Lab. The sensitivity is 79% and the specificity is 33%. And that's the best performing rapid test out there. So now let's do what we did earlier. Predict how it might perform in the field. So as I said, these are true positives. Ano nang tawag dito? True negatives, negative test, no disease. And these are the false cells. This is false positive, and this is false negative. So first, we had 1,000 workers who had no symptoms. Takot tayo dyan eh. Kaya yan natin tinitest. We estimate that the prevalence of disease would be around 5%. So of the 1,000 healthy workers returning to work, about 50 will turn out to have disease that's still contagious based on RT-PCR. And so 950 will not have disease. Sensitivity 79 and specificity 33 of the Zhuhai-Livson lab rapid test kit. So the test will detect 79% of the 50, so mga 40. It will miss 10 of the contagious people. Of the 950 who are healthy, it will correctly classify 33% or about 300 patients and misclassify about 600. So mga false positives yan. So what will happen if we use this test to clear workers? We will have about 676 patients with a positive test and 324 with a negative test. Most of the positive tests are false positives. And most of the negative tests are correct. Kaya lang we're missing 20% of the sick people. Now, there are many problems arising from that. We're missing 20%. That's what we're looking for. Healthy people who have no symptoms, who are actually contagious, and we're missing a lot of them. And the other problem is the false positive tests. These patients or these workers will be wrongly isolated. Their return to work will be delayed. They will need additional tests, which adds to the expense of doing the rapid tests. Their contacts, their friends, their relatives will have to be tracked. And those relatives and contacts may be wrongly quarantined. Remember, these are false positives. And finally, many of these workers will have a false sense of security after. No? They'll feel may antibodies na ako, so I am now resistant to this infection. So this is why the Center for Disease Control in the US says that antibody tests for COVID-19 are wrong up to half the time. And it's not recommended by the WHO. They should not be used in any other setting, only in research. And the CDC serologic test should not be used to make decisions about returning persons to workplace. And our own healthcare professional organizations, including the Society of Microbiology and Infectious Diseases, our top scientists, the College of Physicians, and many more, we do not recommend rapid antibody-based tests for asymptomatic individuals as clearance for work. So what do we use? And to solve this problem of lack of a test, we went back to something one of the earliest doctors taught. And this is Sir William Osler. No? Sabi niya, listen to the patient. They will tell you the diagnosis. What was he talking about? He was saying that not all tests are lab tests. The clinical history, how the patient feels, and your physical examination, they are tests too. And that is why this was developed, the 14-day symptom-based test. What is it? It has 2 questions. Number 1, it has a quarantine component. Have you been exposed through contact with known COVID-19 cases or even suspects? Or have you traveled from areas with community transmission in the past 14 days? If you have, you're a candidate for quarantine of 14 days. So you need to come. And then it has an isolation component. Have you had symptoms of influenza in the past 14 days? Right? Because if you did, then you need to complete the 14 days isolation. We say isolation when you're talking of sick people. We say quarantine when you're talking of healthy people who have been exposed. So a positive test is yes to either. If you say yes to the quarantine component, you need to assure 14 days quarantine. If you answer yes to the isolation component, you need to stay home for 14 days. So you can't be cleared. A negative test is no to both questions. So we recently did an evaluation of the sensitivity and specificity of this test. And it was this, no? In preliminary studies, 93% sensitivity and 98% specificity, which was quite surprising. Sir William Osler was right. And if we do the same thing we did to rapid tests a while ago, assume a 5% prevalence, 50 sick and 950 healthy people, sensitivity of 93 and a specificity of 98. Of the 50, those two questions will detect 46, but 4 will be missed. So less than the 10 from rapid tests. Of the 950 who are healthy, 931 will not have symptoms. There will be 19 false positives. Baka they had some other form of flu. So 65 positive tests, that's the prediction. About a third of those will be false positives still. And about 900 negative results, most of them will be correct. We will be missing 4 patients with disease. Now, what are the problems here? Well, we don't think the false positives a problem because you need to quarantine them anyway if they have cough and colds or exposed to patients with cough and colds. Even if it was not COVID, no? If it was flu, they could still be contagious. The false negative, these are missed cases, so we need to talk about what to do. There's no perfect test, so you will always still miss those asymptomatic cases. The real problem is in this cell, the true positives, because many people will deny they were exposed or deny that they have symptoms. And that's a problem. And what can we do about that? We need to minimize denial. We need to educate workers and make sure they understand that when they admit their symptoms, it protects them, it protects their family, it protects their co-workers and their community, and it will help return the economy to normal faster. We should also provide free healthcare. So PhilHealth is now designing packages for patients with COVID who don't need admission. And we need to get that out as soon as possible. Probably we need to consider longer sick leaves this next few years. 2 weeks probably is not enough. Compensated sick leaves, and maybe allow work from home as alternative if you're having symptoms. For people who are not employees, officially employed, social amelioration packages should continue. And we should change this attitude towards presenteeism. Now, even in medical school, we praise students who go to work even if they're sick. No? Hindi na pwede yun. The new normal is, if you're sick, stay home. Presenteeism is the absent of absenteeism. Absenteeism is when you're absent even if you're not sick. Presenteeism is being present even if you are. And that's probably the worst crime in this pandemic. So the most accurate test to use is the 14-day test. And that's what the WHO recommends, and the CDC and the leading medical organizations in the country. So now I'll end with other strategies as an introduction to the next speakers for COVID-19 safety. The problem is, this is the same graph. The problem is those missed cases. How do we protect ourselves from those missed cases? 4 out of 50 missed, but that's still a lot. Well, yes, we can test everyone, but we can't use laboratory tests on everyone. But we can do the 14-day test on everyone. The other thing we can do is assume everyone is sick. So it's coupled with a little paranoia. But there are many measures for addressing this uh, organizational community-wide paranoia. And I'm sure our subsequent speakers will talk about managing the workplace, physical distancing, including allowing work from home is a measure for physical distancing, wearing masks, washing hands, and other measures. So work from home, staggered schedule, sanitizing rooms and equipments, fixing the routes to work, to and from, and a daily symptom or exposure questionnaire. So unlike the lab tests, you can do the questionnaires every day. If we cannot learn to trust our coworkers, imagine what the option is. We will need to test them, not just when they return to work. We will need to test them every day because we don't know if they denied it when they return to work after 2 months quarantine. What makes us think they won't deny it if they had it yesterday, right? So I don't think lab tests are an option unless you're willing to do them on everyone and every day. So to summarize, these are the recommendations, the general approach to keeping the workplace safe. Test everyone, test every day, but not lab tests. Use a questionnaire on exposure or symptoms. And we need to build trust going into the new normal at the workplace. To assume everyone is carrying the virus, enable physical distancing, wear masks, wash hands, sanitize the workplace and equipment. And lastly, our own role, end presenteeism, stay home when you're sick. So thank you for your attention.
Thank you very much, Dr. Dance, for that presentation. Very informative and leading us to know more about the tests. And it's still best to be truthful before you go to work. Previous where the places you have been to, have you been sick? And that will help to ensure the safety in the workplace. So thank you very much, Doc, for your presentation. Next up, we will, okay, thank you, Dr. Dance. So next up, we will be having a talk from our colleague from Nestlé Philippines. From Nestlé Philippines. Well, he has a degree in accountancy from the University of the Philippines and has completed his master's in business administration from the University of the Philippines. In his 20 years in Nestlé, he has been involved in all the tasks regarding supply chain, and he has been a participant in the Japan Institute of Logistics courses for 2 batches in Yokohama, Japan. He was also a former SCMAP president for 2010 and 2011. And now he sits as a member of the supply chain MANCOM for Nestlé. He is handling intermarket materials for Nestlé, covering raw and packaging materials and import and export. So to tell us more about what Nestlé has been doing about protecting the workers going back to their workplaces, let us all give a warm round of applause, virtual round of applause for Mr. Dennis Llovido.
Thank you, Ochi, for that generous introduction. Can you just confirm if you can hear me?
Loud and clear, Dennis.
Okay, thanks, Pio. Thank you, Dr. Dan, for a very good introduction. Actually, your presentation actually is really related to what I'm going to present for the best practices that Nestle actually implemented in the past months. I'll just share my slide. Okay. Just let me know if you can see my slide already.
Yes,
Okay,
Dennis, it's
thanks,
there.
Christine. Before I start, I just wanted to tell everyone that for Nestle, our employees are our biggest and most important asset. This is why the safety and health of our employees are our main priority, especially during the time of crisis. Actually, so my presentation is actually divided into two. The first one will be more for our distribution center, for our warehouses, including our materials management center, where I also handled. And the second one will be some of the sharing of what we did with our head office in Makati and what are the new norms that we actually implemented moving forward. We'll be implementing moving forward. Okay, so for our warehouses, what we did was we crafted a one pager for all of our internal controls for supply chain related operations. This is the guide actually given to all our 3PL service providers. So as you can see, um, we have enhanced COVID-19 measures for the DCs, external warehouses, and MMCs. And also, this includes the daily health declaration and temperature, which actually Dr. Dance talked a while ago. This is a daily questions that all personnel should actually be answering, including the temperature checking, where they actually log it in that particular form, where the security guard is the one logging it. There are a series of questions that they'll be answering as well with a yes or no. And then at the bottom part will be more of these are more of the advices um, or some of the points that they need to follow where they're inside our facility. So this is just one pager. It's actually posted in all our sites before entering our distribution center or materials management centers. Okay. What we also did is we come up with a program to actually combat mental and physical resilience. Um, Actually, in our sound system, what we do is every hour, there's always a reminder to everyone about social distancing and frequent hand washing to make sure that it's actually embedded already in the minds of everyone. Because well, to tell you honestly, once you're actually working already, you'll actually forget everything about social distancing and frequent hand washing. So that's why the every hour reminder from the sound system actually prompt them to you know distance themselves from their fellow workers, as well as remind them to always wash their hands. And also, we come up with a few tips that we also always send to our Viber group. So, for example, each of the DCs, each of the MMCs will have Viber groups that everyone, particularly the supervisor, will be getting advices. And these are the ones being shared to our daily operations reviews or our shift operations reviews. And also, which is actually the one thing that we were proud of, is actually for all our distribution centers and warehouses, Nestle provided like vitamin C for everyone that they should be taking every morning shift and afternoon and in the evening shift. This is of course on top of the daily Milo that we actually provided them to boost their energy, as well as for coffee for our 3-in-1 mixes. Um, if you look at the pictures on the right side, you will see these are the activities that they need to do before entering our sites. So, of course, they have to fill up the health declaration form. Our security guards will do the scanning, and then of course we provide them each of the site foot bath so that they can sanitize all their shoes before entering. This actually is being logged in our monitoring sheet and being tracked as well on a daily basis. If there will be symptoms actually coming from that one. And then should in case they'll detected with a higher temperature compared to the normal one, they'll be requested to stay over, because sometimes in an environment when people are actually using public transportation, there are times that really when you first do the thermal scanning, you will have a high temperature. We let them sit for a while, rest, and then we'll do another check. If it's still on the negative, it is on the higher side, that's the time you already advise them to go to our clinic or go to the isolation area, which I'm going to present later on as well. Um, and when it comes to our workplace, so it's mandatory for everyone to actually wear face mask. We started it as early as March. Everyone actually working in all our warehouses are actually wearing masks already. And we already provided some barriers in the workstations. As you can see in the picture on the left side, the people in our warehouses were already been segregated, giving them distance from each other and providing them barrier to make sure that we are actually preventing the spread of the virus, should in case there will be. And also, in some of the warehouses as well, we even come up with flexible work arrangement. For example, for those areas wherein it's still under GCQ or ECQ, what we did, we come up with every other day work. For example, for one of our warehouses, we do it MWF, and the others will do it TTHS. For Makati, which later I'll share as well, that we also did some flexible working arrangement. And even in our canteens, in our pantry area, we also have segregation or flexi barriers to make sure that that we also practice social distancing even in the canteen area. Even for the waiting area, we used to have chairs seated beside each other. So we make sure that it's actually 2 meters away. And then we add additional, how do you call it, hand washing area to make sure that everybody will be aware. For the distribution centers and for our Makati head offices, we put up additional um, hand wash area, particularly for those that are frequently being passed by all personnel. And every shift, what we do is that before the next shift will be coming over, our utility personnel will be doing the sanitation for all the workstation. So they're not allowed to come in until such time that all the workstations have been sanitized. For our Makati head office, what we do is that every 6 o'clock in the afternoon, evening, or so to say evening, everybody is actually required to leave the office because they'll do the sanitizing of all the workstation. And every Wednesday, all people in our Makati office are requested to work from home um, because they'll do a whole day sanitation of the entire area. That's on top of the sanitation on the weekend. And because we're logistics, we're supply chain, we cannot miss as well our guidelines for our truckers. So what we do is that we actually sanitized all the trucks, particularly for those that are commonly touched point areas. For example, the doors, what do you call it? Actually, even the container vans at the back, which is the one being touched by the warehouse personnel to open the container. And all the truckers are actually being requested to actually bring sanitizers, always wear mask, as well as alcohol in their fleets. Okay. And just to share as well, especially during the ECQ or even until now, we still have some warehouse personnel were having a difficulty in using public transportation to go to our warehouses. So what we did was actually provided them decent accommodation and shuttle services as well for others. So if you can see, we turned our training center in a mini like hotel inn, and it provided each one of them their own specific beds and pillows that they can actually use. It's not for sharing. So there's actually a name for all the beds. Each of the warehouse personnel who are staying in will actually be given their own allocations. And for the others, for example, for the truckers lounge, actually we're actually staying as well. They converted some of their places into a mini accommodation as well. As you can see at the bottom, it's actually segregated. It's not a hospital, it's actually a garage, or it's actually a part of the parking area where they converted it for a sleeping quarter. And it's actually segregated by plastics in between. For our truckers lounge and our truckers offices, they also do sanitations. It's not just for our warehouse personnel, but also for the truckers. So they do a lot of sanitations. And then for the lounge, we actually put barriers in between chairs to make sure that there's actually distance apart from one another. So that's how we do our truckers lounge areas. And in our facilities, we actually have isolation areas. So this is the one that I'm talking about. That should, in case upon entry, we screen a particular person who actually have high temperature. Despite repeated tests, they also have high temperature. So they're actually put it in an isolated area. We have our in-house nurse actually inside all our facilities, and every other day there's a doctor assigned in our warehouses as well. We also work with the Department of Health, following this what we call the algorithm, that should, in case there will be symptom like when it comes to COVID, we have to actually have to follow this. So we have the PUMs, criteria for PUMs, criteria for PUI. This is actually being cascaded to all supervisors, safety officers, and also to all the warehouse personnel. So that if they have symptoms, even if they feel something different within their body, actually, while they're still in their home, we advise them not to go to the warehouse, to the office anymore. And then you can see his as well that one of the things that we're doing, should in case there will be really suspected personnel, then we have to align it with the barangay officials, and then the barangay officials will actually take over already for that particular scenario, or we need to go to a particular hospital. So fortunately, we didn't have that experience yet for all our warehouse, except for the barangay. We have one, but it was actually cleared eventually. So it's just a regular cough. And what we did to make sure that all our sites are actually ready, we did what we call a mock-up drill. So we have a series of mock-up drill that we did for everyone. So for our Cebu, for our Bacolod, for our Cagayan de Oro, for our Laguna, Bulacan, and the rest of our warehouses, what we did, we come up with a mock-up drill. We talked to all the safety officers on site, including the representatives of each of the 3PL working in for Nestle, and we come up with some of the drills. So should in case we found like this one, what we're going to do. So everybody should be aware of what to do. It's not just on the paper. It has to be, how we call it, memorized, or it's already everybody is actually aware of what to do should in case something would happen. So, and also we discussed what are the things that we need to do should in case there will be cases. What logistics do we need? Do we need ambulance? Do we need special shuttles to actually service these people? These are the things that actually discussed on that one. And we actually reviewed and worked with DTI and DOLE on what will be the interim guidelines should in case there will be cases for our warehouse personnel in the office. So actually, just particularly during the ECQ, what we did was for our warehouse personnel and our trackers personnel to come to the office, what we did is we actually work with TTI and AITFT to come up with the IDs so that they can actually allowed to work, and also the rapid pass for them to be avoid to be held at checkpoints. And also just to add on as well, to appreciate the efforts of our supply chain frontliners, we also supported our warehouse personnel with some of the benefits actually coming from Nestle. So as I mentioned, we provided them daily vitamin C. We actually provided them meal allowance as well, so that they don't need to go out of the facility. They don't need to go um, to get food. So what we did is to provide them meals inside. And for those who are actually staying inside our warehouses, we actually provided them 3 sets of meals. So whether you are actually on the morning shift or actually night shift. Um, of course, we provided them Milo and coffee daily. And just for them to be appreciated as well, we also give them cash incentives, because it's really difficult, particularly for the warehouse personnel, to be away from the family, and they'll be staying inside our warehouse for like a month or even longer. So what we did, we provided them daily incentives for those who are actually working on a regular basis, and a higher cash incentive for those that are actually staying in the warehouse. Aside from the cash incentive, we also give them gift packs to really encourage them to work in our office, and making sure as well that they're actually safe inside our warehouse. So aside from our warehouse personnel, we also give daily gift packs as well to our um, truckers and drivers and helpers, so that they'll be encouraged as well to sustain our operation, despite all the anxieties of the warehouse and drivers that they'll be on street already, um, to encourage them so as not to disrupt our supply chain. We actually give them all of these incentives so that they'll be encouraged actually to work. And we also have our own version of ayuda. So we give them, I think it was during the last day of April, or during the last day of the ECQ, we actually provide them on top of the gift pack that we provide them on top of the Nestle products, we provide them the ayuda type, like rice and sardines and some canned goods, so that they can bring actually to their families once they go back. Um, we also provide them gift packs as well, not just for the warehouse personnel and for the drivers, but also for our brokers. The brokers are actually working on skeletal in their own offices, to encourage them as well, so that all the importation and export will still continue. We are actually sending them weekly gift packs of Nestle products, to encourage them actually to work. Okay, so that's actually one of these are the things that we've done for our warehouses. And just to share as well for our Makati head office, before I start with this one, I just wanted to share what we actually did for Makati. So during ECQ, all our Makati personnel are actually working from home. So for the month starting March, I think March 16 until end of May, everyone was actually working from home. Our third-party personnel assigned in our Makati offices were also provided desktop and laptops, so that they can actually work from home as well, with of course Nestle access. And and also, which is one thing that we also like when Nestle implemented this on the work arrangement during GCQ. I think it was starting June 1. We are still working from home. For the first week of the GCQ, all the Makati personnel are still working from home, because Nestle was saying that it's good that we observe first what's happening on the streets. We observe first what's going to happen on the first week, because everybody will be jumping back to go to work, and to avoid really contamination. Everyone was actually requested to work from home. And during the second week, to lessen as well the people working in our Makati office, we're actually grouped into 4 groups, so that only 25% will actually be working in our Makati office during GCQ. And not to force everyone to work, it's still voluntary. So approximately, if you say 25% were actually requested to work, but since it's voluntary, only around 10% will actually be working. But the rest are still working from home, to make sure that that everyone is actually safe still, on on this particular period. Um, just to give a big just to show as well on the pictures that I've attached. So we actually come up with, before the entering the building, we have designated areas for people to stop to make sure that we won't congest, because this is actually the common entry for all people who are actually using the public transportation, because we have a different entry for those people bringing their own cars. And if you see on the floors as well, in all the in all the floors in our Makati building, we actually designated one-way um, signages, so that we avoid, we avoid those yung magkakasalubong ba. So it's going to be like a one-way. So going to the restroom is just going to be one way, and going back to your workplace is another way. So you can't use the same way when you go to the restroom and going back to your workplace. It's actually different. And actually, as you can see, this is latest actually implemented last June. The workstation in our Makati also have this barriers, and to avoid contacting as well with our fellow personnel. And we also have our own version of our health declaration. And to make it easier for them, we have the online, wherein everybody will have to scan that even prior to leaving the office, even prior to leaving your respective houses, they have to fill this up. And if they answer even one yes of all those questions, then they are actually required to just stay home. So without even going to the office. And I just wanted to share a video of what was presented actually to our to all the employees actually working for this one. And let me know if you're actually hearing this.
Yes, clear.
Okay, let me just share my slide again. Okay, and then we also come up with this one pager as well, what we call the hotline, should in case they experience something. So we have the MAU clinic as well. And also during the ECQ period, there are also Nestle values as well the mental well-being. So that's why we come up with like a psychological guide and resource, should in case we need some for most of our employees as well. And just to share as well the new ways of working, I just not just enlisted some, but these are not just we have a more of this one, but I just highlighted a few. So one is again, so it's going to we will have to wear mask at all time. So Nestle is actually providing mask every day. Upon entering, you'll have to pick up a new mask, even though you already have a mask. When you come to our office, you have to change that with the mask provided by Nestle. So elevators would have a limited capacity, so it's actually maximum of 4. and everyone actually requested as well to make use of our lobbies, and to make sure that we don't have congestion at the lobby, even though it's already 25% that we are requested to come in the office. We are still divided into different teams as well to come in the office at 7:30, at 8, 8:30, 9 to 9:30. So even with the 25% attendance, to avoid congestion at the lobby and to avoid use of the elevators, we are actually subdivided as well into mini groups upon entering the office. For now, we are not allowed to travel. So all the training abroad, even locally, were actually canceled. So we are focusing more of what we call the e-learnings. So Nestle has developed, well, this has been for so many years already. We have developed the e-learning, and this is the one that's being promoted by our head office in Switzerland, to make use of the e-learning as part of the training for personnel. Factory visits as well. For example, for the Luzon base to go to Cagayan de Oro, it's prohibited as well, unless it's necessary that we need to go. But as much as possible, don't travel. We're not allowed to do physical meeting. Everything is actually virtual. Uh, if required, the meeting rooms that used to have like around 10 to 15 person capacity, it now has a limited capacity of maximum of 4. So that's why all the chairs are actually segregated. So not segregated, we only have 4 chairs inside that big room to make sure that we only limit the attendance in a room. And as well, we are not allowed to do external meetings, and suppliers are not allowed to visit us in Makati. So everything will actually be virtual for now. I think that's it for Nestle. So I'll just wait for your questions actually at the after the last presenter, and we'll try to answer some of your concerns. Thank you.
Thank you very much, Dennis, for that very comprehensive, detailed sharing about your best practices. Siguro hindi lang sa Philippines, best in class yan, pati worldwide. I must imagine, because we were speaking earlier and you mentioned that there was no problem in the supply chain because of the preparations you did prior to COVID-19. So thank you very much, Dennis. Thank you very much.
Thanks, Ochi.
Now we come on to our last talk for this afternoon. Our speaker is a graduate of the University of the Philippines with a degree in microbiology, and has held positions related to this discipline in Swift Foods and in RFM. He is currently employed with Fast Logistics as Assistant Vice President, overseeing the logistics providers' facilities in Cabuyao and Cebu. He has completed a course in supply chain management at the De La Salle University Graduate School of Business, and is currently taking up his master's in business administration at Southfield International. So let us all welcome Mr. Marvis Marfil. Marvis?
Good morning.
Hi, good afternoon.
Yeah, it's always good to hear, to be greeted as good morning. I'll share my screen.
Yes, Marvis.
Hi, Sir Pia. Can you now see my screen?
Yes, we're clear.
Okay. So for this afternoon, I'll be presenting how FAST prepared the organization after the 3 months of lockdown. So we appreciate hearing from Dr. Dan on the testing. And then from Mr. Dennis on the practices that they're doing in Nestlé. So what I will discuss are the things that prepared us in the organization to better convince our employees to report to work since we cannot all afford to do work from home. Also, I will share how we prepared all the stakeholders gradually to resume the operations. So this will be the outline of my discussion this afternoon. So let's go back where the crisis started and became a big problem up until now. The crisis started in China and turned into a global pandemic, putting much of the global population in partial or total lockdown. Well, here in the Philippines, border restriction and lockdown measures are provided a short-term negative impact in our warehouse operations since workers' access to transportation became limited. And the problem is coupled by different LG implementation of lockdown policies, which become a crisis for us supply chain practitioners. So before I go to the new normal practices, allow me first to share with you how our company reacted to the crisis, since the outcome of these actions will determine the level of preparations and the readiness of our company and stakeholders to start with the new normal. And to know the extent of the COVID crisis to fast is to see our operations profile. You can see in the slide that the chunk of our business and people are deployed here in Luzon. So this posed great challenges to us, especially during ECQ, on how we can sustain the operations with very few people available. We have no choice but to activate our business continuity plan. As we all know, business should have BCP. That should outline the potential impact of the crisis, and then we create policies to respond to help the business recover faster. We all are not prepared for this COVID-19. Its risks are new to us. It's very unusual, but we have an existing practices, procedures, and protocols that we use as leverage to deal with the crisis. In this slide, we can identify 4 key players that we think will help us overcome or survive the crisis. Not all of the 4 I mentioned forms part of the organic BCP team, but working closely with them has been the best strategy so far that we did in FAST. In working with our suppliers, it's important to answer the following questionnaires to assess the risks and plan for the next action. So do you have many suppliers? How many suppliers do you have? Do you have alternative sources? Do you have SLA with them? And then when we talk of working with suppliers, visibility into the supply chain is usually easier for local companies such as FAST. As we have fewer suppliers as compared to those with, say, 10 more suppliers, 10 to 20 suppliers. We know our tier 1 and tier 2 suppliers, which makes it easiest for us to react to surges in demand, or even during emergency situation. So in this slide, we can see how many suppliers do we have in the company for the MHE, for the office supply supplier, for the security guard, which makes it easier for us to communicate and react to additional requirements if in case it's needed. Second is working with our customers. Managing customer relationship is very critical to the ongoing success of the BCP. Our company's ability to respond needs to follow this crisis and have a direct impact on our reputation. Working closely with our client on a daily basis, just to analyze some data like attendance, volume, refusal, is very effective to sustain the flow of goods in and out of the warehouse. Necessary contingency plans are being developed just to match the existing resources available. because during ECQ, we encountered shortage in manpower. We also have customers who had announced early slowdown of their volume. And this triggered the button to pull in and activate resources immediately. So we have open communication with our customer and our people to ensure that during lockdown, we can always activate them if needed. So looking at this slide, we can see the attendance performance per group. Those Luzon operation with above 90 rating was the result of the immediate response of our client to support us in the contingency presented. It was mentioned by Sir Dennis earlier about the stay-in arrangement, the transportation, and we're lucky enough that our principal, our client, supported us on this endeavor. So the utilization of the truck will bring me to the third stakeholder, which is our trucker provider. Working with our transport provider during the crisis isn't that easy because the business began to slow down. We need to ensure sustainability of the trucking business. One issue that we faced last March and April is the lack of trips associated with the reduced volume. Fleet usage shifted to smaller units. Hence, the role of our control tower became crucial to allocate the trips from one side to the other. Also, since we need additional L300 to shuttle our people, we also utilize these units from our trucker, which also allowed our trucker to still generate revenue. In the process, both FAST and our service provider, specifically our truckers, sustained the availability of resources to quickly adjust to the volume as the lockdown situation started to relax in some areas. Working with our people whose health are our top concern is also a challenge for us. It is possible that COVID-19 will sicken them or worse, force them to do quarantine. It is critical to establish that enables our employee to continue to function without endangering them. We first address their immediate needs, which is transportation, as what Sir Dennis shared earlier. And then we also provided PPE and vitamins. While they are in the workplace, we monitor their health status through site nurses and safety officers. We also maintain close communication with them for those who can't report, as we can bring them back faster once the operations resumes. We also maintain reliever in our operation. So as if there are peaks or surges in volume, we can always add resources. Of course, when we talk of additional manpower that are not organic in the site, available written SOP allowed non-organic employees to learn the process quickly. Of course, with the guidance of the immediate head. This particular slide shows how we monitor the employee attendance to include the mode of transportation, whether they're riding bicycle, walking, going to work, or using the shuttle. We realize the early importance of the issuance of COE, DTI letter, or client letter before the availability of IATF, which took around 2 weeks from the time of application. Our site admin also conducted telemarketing approach to convince others to report back to work and communicate the safety plans. So this is a classic example that people, when faced with crisis, would want clear, straightforward steps that they can follow and know that their welfare are covered. We created communication plan to include employees and customers with regular updates and situation. Consolidating all the stakeholders in the implementation of BCP. This particular slide summarizes specific actions that we did to make our BCP work to our advantage. Our past 3 months experience during the lockdown, it's not easy. We encountered a lot of struggles and challenges, which tested the unity of the company. We thank our people for standing still and staying strong, just to ensure that we help bringing the food and essentials in the shelves. We realized that the key factors is end-to-end visibility. Linking the 4 stakeholders, our suppliers, our customers, our trackers, and employees, allowed our site operations to provide the expected service to our client. Of course, let's not forget the role of leadership in the equation, from top to middle and ground level management. We do regular alignment on a daily basis, which is the key in solving all the issues we encountered on a particular site. So this is a sample war room. This is a picture of our war room in Alabang office, serving as our command center to consolidate all the data, information from the 94 sites that I had mentioned. Said visibility gives us flexibility to respond quickly to the needs and flow of customer demand, especially if there's a need for additional labor and resources. Not less than our president, Mr. Chongbian, and the rest of the business unit heads are having daily meeting to discuss the operations. They have to reduce the frequency to 3 times per week in April and once a week in May and June. Prior to the top level meeting, middle and ground level management are first discussing the data and strategies, then summarizes them for escalations. This kind of management support gradually prepares our organization to transition to the current quarantine scheme, going to the new normal, since all stakeholders' interests are protected during the past 3 months of quarantine period. As we transition to MGCQ, to the new normal, we need to sustain and improve these practices to ensure we stop the spread of COVID-19. Based on this control hierarchy from the National Institute for Occupational Safety, it says that the most effective option for now to protect the economy without putting the employee in danger are still PPEs and administrative controls. Organizing and implementing a safe return to work during the disruption poses significant challenge to all of us to avoid second wave of infection. To provide the greatest measure of certainty, it is critical that best practices be shared across industries. That's why we're all here to discuss best practices. Without clear processes and guidelines, individuals may fear for their health and businesses may reserve to reopen. In the next coming slides, I will be showing some practices being done in some of our sites to serve as precautionary measure to help the spread of COVID-19. Some of the practices was shown earlier by Mr. Dennis. So this one, so we do temperature checking for all incoming employees, suppliers, and service providers. Aside from the employees' temperature checking, each site are conducting health screening procedure, such as asking employees about COVID-19 consistent symptoms, using a questionnaire or checklist. Other safety measures such as wearing masks, which the company provided, and physical distancing are additional temperature checks being followed not just by fast employee but other personnel as well in the site. Separation of access for incoming and outgoing employees are also being implemented. The first phase of resuming office will involve making basic changes of office layout. So even without everyone returning on the same day, communicating a plan supported by the whole leadership team gives your employee confidence coming back to the office. So with this, we utilize a map that reflects changes as soon as they were published. Everyone will know exactly which part of the office are safe to use. We also allow the use of other areas such as conference rooms as part of the strategy to allow employees to follow safe distancing. Some employees that are not critical in the operations are also allowed to work from home. So we have distributed as well some hand washing facility. So we encourage a hand washing every 3 hours for all our employees. So as you can see in the picture, since not all of the sites have big areas or available water source, some employees took the liberty of improvising some available materials using damaged upright posts, used drums, so as to ensure that every personnel in the site are washing their hands. We also do cleaning of other high-touch area or surfaces such as doorknobs. For some sites who do not have much plenty of personnel, they remove the doorknob and replace it with the bracket of the fire extinguisher to serve as a pedal handler or serving as a pull lever for the door handle. So same as Nestlé, we also have provided foot bath and portable sprayer. So aligned with the social distancing measure is minimizing exposure. We do online customer engagement. We do our BRs using online platforms. Employees are still encouraged to hold small meeting groups like toolbox, daily operations meeting, and focus meeting for as long as they're practicing social distancing. Other measures allowing working remotely or work from home is also encouraged. Even in our Alabang office, it's now at 50% workforce. But all this arrangement doesn't limit people development. So since we do training online, we also sustain our MHE operations training. But this time, we do it split teams, meaning one team training in the south and one team training in the north. So lastly, home pickup by shuttle going to workplace, which I mentioned earlier, was the first action and initiative since the start of the pandemic. Here in Luzon, until we expanded the practice to Bismin. As costly as it may sound, but this initiative were able to maintain the safety of our 8,000 employees as we remain COVID-free up to this date. So the remaining chart will just encapsulate the individual practices I have mentioned. So for this one, this is our practices for the pickup of our employees. Then second, for the hand washing when they are at their homes, when they are in transit, when they are in the office. And even in the warehouse. So overall, this COVID crisis presented significant challenges to us in the supply chain. It tested our ability to flex with the demand. I believe now is the time for business owners and executives to focus on making necessary adjustment to our operations in order to survive this pandemic. Employee safety should be our utmost concern. Our people are our company's most valuable and important assets. So when there's a potential risk to their well-being, we need to have a business continuity plan in place to protect them while also enabling our operations to function effectively. So thank you, and I hope I've shared something of importance to each and every participant of this call. Thank you, Ms. Anne.
Wow, thank you very much, Marvis, for that presentation. And it just is so refreshing to note that also our third-party logistics providers are doing sufficient measures to ensure the safety of their workers and their other suppliers. Thank you very much. So we now have a few minutes. I think we have some time for a question or two. So from our chat box, wait, there was a question earlier. And this is for Dr. Dance. Dr. Dance, are you there?
Yes, I'm here. I'm here.
There was a question on whether the pandemic, is it weakening, or there are some news about having a second wave. What do you make of this news, Dr. Dance?
Well, so if you look at the shape of the curves, okay, so there was an increase in the number of cases per day. This past maybe 2 to 4 weeks already. It's almost as high, if not higher, than our first peak around early middle of March and early April. Now, many people attribute that rightfully to an increase in testing capacity. Right? So what I like to look at is the curve on deaths, because deaths are people who are sick and confined in hospitals and who have life-threatening disease are more likely to be tested. So that's more or less constant. We did not increase our testing rate of hospitalized patients. We increased the testing rate of outpatients, the ones with mild disease. And in that curve, we can see just minor rises and falls from delays in testing. So I don't think there's an increase. It's too early to tell right now, but we're all anticipating it because it's been almost a month since the partial lifting of community quarantine.
Yes.
And this is about the time we're going to see if everyone learned their lesson during ECQ. The purpose of ECQ was to make everyone aware of the strategies to mitigate and minimize the pandemic. So we'll know. I don't think the rise in cases is something to worry about at the moment. But we need to keep our guard up and do those things, practice physical distancing and hand washing and wear masks.
Okay, thank you very much, Dr. Dance. This question is for our two other panelists, Dennis and Marvis. So last words. What can you, last final words as we close this first webinar for SCMAP? How do we keep ourselves healthy and safe during this pandemic? Okay.
Well, actually, one of the things that we're I like what Dr. Dan mentioned about the trust. We really need to trust our employees. So on the employee side as well, we need to be honest. So we need to really to tell what we feel, because at the end of the day, if it's impossible for us to do the lab testing, I mean, rapid test for all. So we just need to make sure that we'll be honest, and the companies as well. We need to trust what the employees are actually saying. And also, I like what Nestle is doing. It's more of a voluntary. So everybody was like doing a flexi work arrangement. If a particular function can be done from their respective houses, we encourage it to actually be implemented so as to avoid overcrowding in the offices. There's common touch point even though the workplace has already been segregated. The common workplace, the lobby, the common area, the lobby, the elevator, it will still be congested if 100% of the people will actually be working directly. So that's why we really encouraging actually the combination of work from home, particularly for those functions that we can actually do from home. And of course the combination of course the work from those that needs physical. So for example, the warehouse personnel, the DCs, the factories, that they need to really to report. But of course, the office personnel could actually reduce that as well.
Okay. Thank you, Dennis. Marvis?
Yeah, for me, ma'am, agree with Mr. Dennis on the trust, but at the end of the day, people will believe what they see. So it's important for us, companies, leaders, to show our people that we really care for them.
Yes.
So what they have experienced in the past 3 months will remain in their hearts, whether they're seeing that we're protecting their interests, especially in the logistics field, where a lot of volume needs to be taken out of the warehouse. So if there's opportunity for these people to keep enough rest, allow them to, if possible, and also offer some facility that will encourage following all these prescriptions.
Okay. Thank you very much. I know there are still some more questions, but in the interest of time, we'd like to thank you for joining us for our first edition of SCMAP Live. We would like to thank our speakers, Dr. Antonia Dance, Dennis Llovido, and Marvis Marfil for lending us their time and expertise and allowing us to learn more on how to keep ourselves safe and protected. Indeed, while COVID-19 is a unique challenge, we can overcome this through information and following health and safety protocols to mitigate the spread of this disease. Again, our appreciation for joining us today and for trusting us with your time. So for our participants on Zoom, an online feedback form will be open on your browser once you leave the webinar, and we would appreciate your thoughts so we can mount better events for you. And finally, you can keep with us with other SCMAP activities by visiting our website, scmap.org, and by following us on Facebook, LinkedIn, and Twitter. We are also accepting sponsorships to our forthcoming online events. You may contact our secretariat for more information. So until our next event, stay safe, stay healthy, and God bless us all. Thank you very much.
Thanks, everyone.
Thanks. Thanks, Dennis.